The NHS is the largest public sector contributor to climate chaos in this country. We produce 18 million tonnes of carbon dioxide a year. The NHS Sustainable Development Unit is tasked with providing leadership to ensure that we meet the government's climate change targets by 2050. About a fifth of the carbon emissions from the NHS are directly attributable to travel. One of the things we can do is, instead of moving all those people around, is move information around.
The West London Cancer Network is a group of 9 hospitals, 11 sites, and one of the 34 cancer networks in the country. The West London Cancer Network video conferencing solution was only made possible because we were able to use the N3 network, which enables simultaneously transmission of video, images and data so that you can display them alongside each other. We are able to hold meetings every week. These are multidisciplinary, and we hold those in virtual space, joining all the hospitals in the network together. And we're able then to discuss each individual patient, seeing, say, the X-ray from one place and the pathology from another place. Over the last year, we have audited the benefits of this system, and we have discovered that over 5,500 hours of consultant time and 10,000 or more hours of general NHS staff time each year are saved by using video conferencing rather than travelling from site to site.
Many parts of this country are sparsely populated, and it's a particular challenge to know when someone is sick, where to take them. Do you take them to a local facility, which is close, or do you take them to a more specialised facility, which is further away, takes longer, is more environmentally damaging, is more inconvenient, it's more costly?
The BT network allows us to deliver a wide range of services across the 160 sites that make up the Cornwall community. At one extreme, we do things like telemedicine, which brings patients and services together.
We've linked a number of our remote minor injury unit sites to the main A&E department at Truro, using video conferencing technology to have expert diagnostic opinions from the consultants advising the minor injury nurses at the remote sites.
A second example is the learning management system, which allows us to deliver courses to where people actually carry out their job rather than having to go to specific training sessions. It is a great example of 21st century technology supporting 21st century healthcare.
Inevitably, and we found this through good research, that better care is provided by centres where you have a critical mass of professionals. The great challenge is to make sure that high quality care is accessible to all.
The Kent Cardiovascular Network was set up to provide seamless and equal cardiac care for the population of Kent. We use N3 broadband to send images quickly up to London. The most important images that we have to send are angiograms, moving X-ray pictures of the heart arteries. In more complex cases, we can have a real-time discussion while the patient is on the table. We can then decide on the best and appropriate treatment quickly. That can be a balloon angioplasty done there and then, or the patient may be referred for cardiac surgery in London. In the last year alone, we have done nearly 400 angioplasty procedures safely here in Kent. Prior to that, patients all had to travel to London for these procedures. We've estimated we've saved 30,000 miles of patient travel in the last year alone.
The beauty of N3 is it allows us to move around the system, that critical part of high quality healthcare, which is information and intelligence. That benefits the public, it benefits the patient, it benefits the professionals, and it benefits the planet.